Hey everyone, welcome back. So this week we have a quadruped or a cross crawl pattern that happens on all fours. The reason we want to use this pattern is if we're having a lot of upper back stiffness and tightness, maybe some shoulder stiffness and tightness, and certainly some lower back and even sacroiliac joint stiffness and tightness. The point of this exercise and remaining in place is that it allows us to be really intentional. So now that we're back at the beginning, I want to talk a little bit about this cat and cow pose that you just saw. So the important way to start this exercise is go into a little bit of a cow pose first and then arch that only the lower back into a little bit of a cat pose. We don't want that cat pose to take place at the shoulders. We don't want an excessively rounded upper back. We only want a little bit of rounding at the lower back. Again, one of the things that we're doing here in this position is we're creating a lot of anterior compression both at the upper and the lower body. So we get rid of, we kind of eliminate a little bit of an anterior pelvic tilt. We put ourselves into a little bit of a posterior pelvic tilt to start. You can see that right there. Now that the posterior pelvic tilt is gently in place, we can begin the exercise. And so you can see we're in that cross crawl pattern. I'm pressing down with one hand as well as the opposite side. And as I press up, as I raise the opposite side up, the opposite hand and leg, the opposite shoulder and hip, that's when I breathe in. So we're creating that posterior expansion at the lower body, at the tailbone, at the lumbopelvic complex, as well as the upper body through that shoulder and that upper thoracic region. So creating that posterior expansion is going to really loosen everything up. We're learning how to put force into the ground through one side and coordinating that with the opposite hand and knee. So go ahead and give this a shot. See if it doesn't loosen up a little bit of hip and shoulder, internal and external rotation. See if it doesn't loosen up some upper back stiffness and tightness, some lower back stiffness and tightness. I would love to hear your comments on how this affected you. As always, would love to hear your questions about this. Thanks so much for watching, and we will see you here again next week.